What's up, guys? John here. Titan Talk. Titan Talk has begun. So we didn't get to do a Titan Talk Tuesday. I know I came to you guys Monday for a little bit, but I want to cover a lot of different things. First off, I hope everybody had and has had a Happy New Year so far. So I know New Year's resolutions are upon us. NYE came, we saw, we conquered. Now it's time to put some action behind those words, right? So we talk about New Year's resolutions and all the great things that come with New Year's resolutions. Now, New Year's resolutions could be a lot of different things. And I hope what you did was, I hope you just didn't talk about it, but you actually wrote it down so you can remind yourself what these goals or resolutions are and what they should be and how you're going to try to accomplish these goals or resolutions. You should always have a battle plan. Whatever you're going to do, try to plan it out, make the most educated decisions you can, and really, go from there. I'm going to talk about events, guys. I'm going to talk about some therapies. I want to talk about New Year's resolutions, obviously. I'm going to go into that to depth with you guys. Remember, New Year's resolutions, it starts now. So Titan Medical Center, this is like what we're game for. I mean, we are awesome with helping people with New Year's resolutions. People are more motivated than ever right now to be and get their New Year's resolutions started. So let Titan Medical Center help you get those New Year's resolutions started. Call or text 727-389-3220. We can help you out with bioidentical hormone replacement therapy, medical weight loss, injectable vitamins and amino acid therapies, sexual libido enhancers, rejuvenation detox, and a lot more, guys. So tune in, call or text us. If you guys have any questions, concerns, you want to sign up, get these resolutions started, now is the time. Take advantage of all the great things we're going to be offering, because I am going to have some great offers for you guys. I want to do something for patients, new and old, so I'm going to do something for them. I'm going to come up with that, and I'm going to release it probably tomorrow or Monday to get everybody really big and hyped. Big Meech, yeah, she's back there. She's definitely talking to a whole bunch of patients. We got tons of patients calling in, current patients, wanting to get really revved up on their therapies and really going on their resolutions. So what is your resolution? Do you have a resolution? Put it on here. Maybe we'll talk about it. But the biggest thing with any resolution or goal that you're going to do or try to accomplish is consistency. Doing it every day or whenever you're planning to do it, make sure that that is priority to do. Put it before anything else at that point. Now, I'm not saying, listen, if your kid's in the hospital or something, don't do that. But I'm saying other major priorities like, oh, this is making me do it, so I can't go work out. Don't get that attitude. That is the wrong way to start. Get it. I'm going to do it no matter what. Somebody says, hey, listen, hey, you want to go out? You want to do this? Listen, I will, but I have to go do this at this time. I'll meet you guys afterwards, all right? Trust me, I know how it is. You got to be consistent. Some of these sacrifices that you guys need to do. Sacrifice some of the different things that you may be doing during that time, like watching TV and not doing nothing, right? Give yourself some activity. Give your body that activity. Do yourself a favor. Get your health straight. At that point, there's a lot of different ways we can go about helping you. But you got to help yourself and want to help yourself first. So his resolutions, be consistent, right? And I know Dr. Big is consistent. It's not a marathon, right? It's a marathon, not a sprint. So he's right. So Justin is right on the money when he says that. It's a marathon, not a sprint. Now, you want to be able to expedite your results, right? And when a lot of people come to me, they say, John, how long is it going to take me to get like this? Right? And I asked him, I go, well, how long have you been inactive? How long have you been eating like that? How long has it been like this? How long has this problem been there? And they tell me, like, maybe a year, 2 years, 3 years, 10 years, whatever it may be. So I go, well, it all really depends on that. I mean, if it took you 10 years to get like that, then at least, I would say give it at least a year or two to try to get back to not like that or get better, right? But give yourself time. Whatever program you're going to get with. What up, Rod? How you doing, dude? Whatever program you're going to get with or whatever you're going to try to do diet-wise, training-wise, whatever it is, be consistent. Give yourself time to get these results, right? It's not going to happen overnight. Whatever you're doing, it's not going to happen overnight. Now, a lot of things can happen quickly or be expedited. That's when we talk about optimal hormones or these different other therapies that we offer. But it does come down to eating right, training or being active, right, sleeping, giving yourself the body, the nutrition and nutrients and the things it needs to grow properly, to heal properly, to progress properly. So if you're giving those things, if you're giving the body those things, your body's going to be in a great environment to give you the best optimal healthy results it can. So do that, all right? All right, so check this out. So resolutions. So my resolution, I got to ask that. John, what's your resolution? My resolution is to progress in every way, shape, and form. I know that sounds like a big resolution, but I try to focus on family, business, and myself, I guess, body-wise. So at that point, that's kind of the priority it goes into, family, business, myself. Always put myself last. I always put everybody before myself, and that's great. I feel better about it. It makes me feel better. I don't feel selfish in any way, shape, or form when it comes down to that, because I always want to give my best to everybody and myself. So at that point, I want to progress. I want to bring Titan to a whole different level, and we are there. So, that's happening. I just want to make sure that I'm sticking behind it and we get to a certain level by next year. That's one. Two, obviously, I want to be in the best shape of my life. Going into 38 years old, in February 23rd, that's my birthday, I'll be 38, and at that point, I want to be in the best shape of my life. I've always had that goal every year when I come into it. Obviously, everybody has the training goal. I'm going to be a better self, new you, new year. For me, though, it's always been, can I get a little bit better? I know it's not going to be crazy different. Like, it's not going to be like an Arnold Schwarzenegger effect like that, but, just being progressed and being able to tell myself, hey, listen, I made these things. I made these goals. What up, Pete? How you doing? So let's talk about a therapy, guys. Since I'm talking about New Year's resolutions, I'm talking about weight loss, I'm talking about lean muscle. Let's talk about the therapy of the week and the therapy of the month. We make this a therapy of the month because I think it's important. I think it's a great vitamin amino acid blend that we have. It will help boost the metabolism naturally. It will give you energy, brain functions in there. It's got a lot of different effects, helping the liver process, fats and stuff like that, as far as the body processing. So Tighten Up is the therapy of the week and the therapy of the month. And as you can see, all the great components that go into it, all the vitamins like your B complex, B12, and it has a branched chain amino acid in there with L-carnitine. So these functions we know with the B complex and the B12 as far as, the B vitamins doing a lot of different great functions. Boosting metabolism naturally, like we talked about, brain cognitive enhancement. So with these things, it will help the body naturally do the metabolizing, right? You have L-carnitine in there. It's great for weight loss, great for blood flow. And the branched chain amino acid, it only has one in there. This one has leucine in it. So leucine is great for weight loss. It's great for keeping muscle. If you're going to a calorie deficit or trying one of these calorie deficit diets and stuff like that, this is a great formula for you. Titan Complete is its predecessor. It's the bigger bad daddy of this mix, but Tighten Up's a great one. It was one of our first ones for our patients. And mixing this with our ECA, or combining the ECA, which is our little capsules, our ECA Stack Plus, which has ephedrine, caffeine, aspirin, B12, and chromium, you're hitting the fat loss in two different ways. You're doing the injectable version with Tighten Up, and then you have ECAs, which are going to do a whole different effect for fat burning and energy and concentration in a capsule form. So when you're combining these two different effects and therapies, you should be able to expedite those results that you're trying to get. And they're really, really good. So if you're a beginner with Titan Medical Center, Tighten Up might be a way to start for you guys with the ECAs and start getting into our therapies. If you're a seasoned guy or girl with Titan, you know about Tighten Up. And if you don't, I can explain it out more for you, or you can go on our website and check it out. Or YouTube, check it out on there. Please go subscribe, check out all the videos on there. There's tons of videos on all our therapies, how to do the injections. That's another question we get a lot of is, how do I do this injection? Is it intramuscular? Is it subcutaneous? What needle do I use? What gauge? Because some patients, and most of them are males, like 64%, they come to us, and at that point, they've never done an injection before. So let's say they get testosterone replacement therapy, and they get like a vitamin amino acid injectable therapy like Tighten Up or Hercules Motion, whatever it may be. They get 2 sets of needles and syringes that come with them. They get a 23 gauge needle, right? With a syringe, a 3 ml syringe, and that's the body, the syringe, and then the needle with the gauge is 23. So it's a bigger needle and gauge. Well, yeah, bigger needle, well, the gauge is bigger. The needle's longer, it's about a 1 inch, it's not a 1.5 inch. Some, and most, a 1.5 inch is what they use on a bigger person with a bigger glute. Usually you can get away with a 1 inch. Most of our patients do get away with a 1 inch 23 gauge. But that's usually for testosterone, and that's only because of the viscosity of the testosterone or what you're injecting. It would be very hard to push it through a 30 gauge. Insulin needle is what you would do when we do subcutaneous or the vitamin amino acid injectables intermuscular. So at that point, they're water-based. They go in very easy, very simple, and you can get them usually into a muscle with that 30 gauge 1/2 inch needle. So at that point, the little orange tops are the insulin needles. That's what you inject your Hercules potion, tighten up, tighten complete, all that glutathione, all that good stuff in with the 30 gauge insulin needle, right? It's got an orange top. If you're taking testosterone, you're going to take, and I think they come in, they come in a clear top, but it's like oranges, or it's a turquoise of the needle and syringe. So you guys don't know the difference. Trust me, those testosterone ones, somebody actually told me, they called me, they said, man, John, I love the way that, Hercules potion makes me feel. I love the effect that it does, but I just can't do this every day. And I'm like, wait, what's going on? Are you talking about the insulin needle? Are you having pain on the injection site? Like, why can't you do this every day? Because I do it every day, and I know a lot of other people do these shots every day, so what's the problem? And he's like, man, when I take that big needle, and I go, big needle, like, what are you talking about? He goes, the blue one, it's got it's a big 23 gauge one. I go, you were injecting with a 23 gauge? Like, you're site injecting Hercules potion with a 23 gauge? Dude, I was like, no wonder why it's gonna hurt, right? That was crazy. And I said, did you check out the videos? That we always send out the patients the videos. And if you don't have the videos, you can go on YouTube or website, call or text us, we can send them to you. They're instruction videos, and they're about what to look for, what to use on these therapies. So, at that point, he's like, well, I guess I just didn't hear right or something happened. And I'm like, well, do it with the insulin. He was like, oh, now I can do it. That's not a problem. Those things are like nothing. I mean, people, they get worked up about little insulin needles, but once they do a little insulin needle shot, like B12 or glutathione or HCG or one of our vitamin amino acid mixes, at that point, they really have no problem. It's not an issue with them. They don't hurt. They go, wow, man, that was really like nothing what I expected. I expected that to hurt a little bit or for me to be sore. And that's not the effect. Now, can you give yourself a shot with a subcutaneous shot or an intermuscular shot with those insulin needles and have a little pain or something like that? Yeah, I mean, I guess it could get stuck, subcutaneously in a different area or just uncomfortable area, and that puts some pressure, but it goes away. It's water, it's a water base. It goes right in, it absorbs. So at that point, it's not going to be sticking around. It shouldn't have lumps for days or weeks or anything like that. So if you guys have questions about those therapies, please call or text us, 727-389-3220. If you guys are on Instagram or even check this out on Facebook, Instagram, I'm sorry guys, I'm showing you my display of what everybody sees on Facebook where you guys are getting to see a little bit of it. So I hope that helps. They fold up, oh, you had it fold up in your shoulder, wow. You're just getting too dense, man. Eric, you're getting too dense. He said he had one fold up in his shoulder. All right, so insulin needles, they're really fine. They're really, really slim and really easy. Yeah, that's the great thing about them. But when you start getting more dense, Eric, it's happened to me where they bend and stuff like that. But it's the way that your angle, you might hit it or shoot it. So just watch where you're going next time. And then you got to be very careful about going straight in and not just putting pressure, about pushing down, because then that will bend the needle. But usually you won't have those problems. You won't have too many issues. So you guys see my display on Instagram. I thought I'd like to show you guys what Facebook is to see every Titan Talk Tuesday. So next week, Titan Talk Tuesday will be back. I can't wait because we've been gone 2 Tuesdays in a row with Christmas and New Year's. I'm excited. I'd like to get back to my day, Titan Talk Tuesday. I was like coming to you guys live and sharing some of all this new great stuff that we got going on. We got a lot of great events coming up. F45 in Land O'Lakes, the new place, like a group class type thing. We're going to be doing an event there. The Gold's Gym Challenge, Largo in Tampa. Titan is official sponsor and partner with Gold's Gym in Largo and Tampa. We're really excited. And Bojacki, my good friend Chef Irvine, the owners of those gyms. And at that point, man, I'm really excited to be involved with them. I'm really excited for the Titan Challenge with them, or the Gold's Gym Challenge. But at that point, like, the Titan Challenge will be coming along with them too. We want them to do their best. So they're going to get discounts on their therapies, blood work. We're going to be in there doing free B12 shots. So stay tuned for those. So if you're in the area, you want a free B12 shot, you'll be able to just come out. Check out the gym, get a free B12 shot. See what Titan's all about. Maybe ask us some questions if you guys got any. Yes, I come out to Anthony's Gold Gym. So, Eric, I don't know. I mean, I got to get an invitation from these places to come. I don't really just go in there and ask them. Plus, Ed is in Largo with Chef Irvine, so I kind of, I got to show them the most love when I'm out there. But yeah, it would be cool. I mean, I've heard good things about it, so let me know. So at that point, more events that are coming up. Jeez, we've got so many. I'll start listing them out. You guys will get the newsletter. If you guys want to be involved with the newsletter, it's real simple and real easy to do. You guys can actually text now. I've got it really, really cool where you guys can. All right, it's easy to join our mailing list. All you have to do is just send a text message. Text Titan Medical to the number 22828. So text Titan Medical to the number 22828. That'll sign you up for our mailing list. You'll be on there, so we'll have all the great events that are coming up, discounts, maybe stuff on apparel, whatever may be going down in Titan Medical Land. That will have the most updated information for you, unless I come to you live, and that will be the most updated information, obviously. But yeah, so I'm glad you guys have tuned in. I think that's enough to really go. Cimarron versus MK677. All right, I'll talk about it since MK was another one. Rob Sanchez asked a good question. What is the difference between Semarelin and MK677 ibutamoren? So they're both GHRH, right? So growth hormone releasing hormones. Growth hormone releasing hormone. That's what they are. One's an oral version and one's an injectable version. Semarelin's been around a long time, so I think the 70s. So at that point, it's been used. It's been used over time. Patients, after so long, build up a tolerance to an effect in a lot of cases and report it back to that. So really not getting too much stimulation in turn of IGF-1 levels going up. Now, MK677 has had a lot of studies now. It's starting to come out more and more. So at that point, it's raised IGF-1 levels in our patients that we've seen. We've had patients go on both. So at that point, some, with Semarelin especially, help with sleep and stuff like that. Where MK677, people have noticed, strength increases right away, sleeping patterns, obviously appetite enhancement, with a lot of different things. And then blood test. So that's the big thing, right? We can talk about it all day. We can do it all day, but blood testing or testing in general is the only way that we know that it's really working or that it is what it is, right? So you know that every therapy from Titan Medical Center is prescribed comes from the U.S. licensed pharmacy and it's tested for sterility, potency testing, and stuff like that. So, that makes a big difference. So at that point, when we see a blood test come back and it's stimulated 30, 40, 50 points, I mean, you can't lie with those results. I mean, it's been really good, especially if nothing else has changed. No diet change, no exercise change, no supplement change, therapy change, except for that one. And that's the best way to do it. Don't throw 100 things at the dartboard and hope something sticks, and that sticks, and then you're like, well, what stuck? I mean, we really don't know because 100 things got thrown up there. So at that point, add one thing in at a time, see the results, be consistent with what it is, and you'll understand, what works, what doesn't work, and you'll really get to know your body. I mean, I guess that's what it is. I'm 38, about to be 38. I'm 37, and I'm giving myself a year already. Jeez. 37. I think I know my body more than I ever have, but I keep learning more and more. I guess every day or every week of what I can do, what I can't do, limitations. You shouldn't have any limitations, but there's certain things with age that comes. So at that point, you just got to be prepared and think about it. So I guess that is peptides. FDA approved? Nope. Some are. There are some peptides that are FDA approved. Thymosin alpha 1 is for immunity. We're going to start those therapies very soon. So Big Polly, that is FDA approved. Semarelin, yep, you got that one. That one was made to be a replacement for GH, especially with kids with dwarfism and stuff like that. Other ones, no. The reason we can do the compounding on the ones from the pharmacy and stuff like that, the pharmacy can do them as far as the doctor thinks that's going to be the best recommendation for the patient to use, to control substances or anything like that as well. There's a lot of different things out there. GHRP2 and 6 we do see going away, so they are banning the compounding of that very shortly. So pharmacies will not be carrying that, and if they do, they shouldn't be, I guess. There's a couple other ones in that street too. So we are up to date as far as you guys are. A little bit farther, I guess, with the lawyers, making sure everything's compliant as far as that goes. And those pharmacies that are compounding, the bigger ones, trust me, they're lawyers. They have lawyers out the yin yang. They're in a good business. They want to make sure that they're compliant too. So, and they're getting inspected by some of these places, especially the pharmacies, compounding pharmacies nowadays. FDA, they've got the Board of Pharmacies. They've got a lot of different things they are got to be compliant for. So, they're getting watched. Trust me. There's a lot of different things out there, especially now, this day and age, that regulation is coming down. Oh, another thing, before we get off. Titan Medical is starting to get the new Titan gear in. I told you guys. Now, you guys can go to the website, TitanMedicalCenter.com, and check out all the leggings and gear we have up there. You won't see these on there yet because I just got them. I got the camo Razorback hoodies, winter. I got the green ones. These are really cool, man. I can't wait to wear these, especially summertime, man. These are killer in summertime. I know some people are like, why you get sleeveless and Razorback with a hoodie? Dude, they just look cool. What do you want me to say? All right? And then you've got the sleeveless full back. And these are on the website, or should be, or they will be. And at that point, you can get these. So you guys can call or text, actually text, 727-389-3220. I'll give you guys one of the new cool shirts.
Oh, yeah.
Titan Gear. Hashtag Titan Gear. Text it, 727-389-3220. Roger Paget, 6'7" on TRT, getting leaner and putting on more muscle than I have my whole life. Good work you guys are doing. Awesome, Roger. That's what I'm talking about. MK677 is awesome, guys. Listen, the reason to take GHRHs like Semarelin or MK677 or CJC1295 or Emperelin or whatever it may be, is to raise IGF-1 levels. IGF-1 levels are going to get you the effects that you're looking for. So that's why you take growth hormone. That growth hormone converts in the liver to converts IGF-1. That's where you get the benefits. So look for that. Don't concentrate on GH this or that, or whatever. What is going to raise my IGF-1 levels without hindering the function of my brain? That's the pituitary. So at that point, know these things. Blood test. So at that point, you guys know, right? All right, cool. Let me mention two more things because I didn't get to do it, and I don't want to get yelled at for not. One, and I don't like to promote it that much, but I will. The Ultimate Health Bible, all right? Your guide to disease prevention, anti-aging, and weight loss. Get it, guys. Check it out. It's on Kindle. It's on Barnes & Nobles. It's on Amazon. I've got the ebook coming soon for you guys, but Kindle has it right now. You guys can get it. A lot of great information in there. I won't harp on it too much, but great stuff from nutrition and hormones, lab testing, things to ask doctors, all different kinds of information and secrets that I like to give out on here, but I just haven't covered them all, and most were in that book. So check it out, guys, all right? And then leave me a review on it. Please let me know how you like it. Please, please, please. The next thing, I have a speaking engagement here in Tampa, right? So I'm really, really excited about this speaking engagement. It's a conversion and marketing summit of 2019. I was asked to speak at this summit. I'm really, really, I'm really honored to be able to share my story with all these people that are going to be there. Sharing the stage with a lot of these awesome people and speakers that have done some great, great things. You always surround yourself with that success, and it breeds success, and you always learn something. Don't ever close your mind down. Every day you should be able to learn something. I do. But this is going to be awesome. It's going to be a great workshop covering a lot of great speakers, a lot of great presenters, and your boy is going to be there, yourself, so I will be there. I never thought I'd be doing something like this or write a book or anything like that. So it's kind of crazy. I'm really excited. I'm very honored to do it. Kind of nervous, but very excited. So guys, get your tickets. All right. You guys can check it out. I'll have the website up there for you guys. And then at that point, you guys can go on there. It's January 12th and 13th. Check it out. We'll be there. Titan Medical Center will be there. I'll have some awesome giveaways for you guys there too as well. Can't leave you guys out, all right? So we'll see you guys in 9 days, 11 hours. All right, guys. This has been a great Titan Talk. I appreciate all you guys. If you guys want the Titan gear, text 727-389-3220. Hashtag Titan Gear. You guys can get some of the exclusive Titan gear that we just got in that I just showed you, or all the new cool stuff that we have on the website, whatever you guys want, all right? Just say, John sent you, Titan Medical Center. All right, Titan Medical Center, YouTube, subscribe, Instagram, Facebook. Make sure you follow our pages and you're sharing this or you're tagging somebody on Instagram, all right? I appreciate it. I'm John from Titan. Happy New Year's again, guys. And let's get these resolutions going. All right, guys, I'm out.